Hello everyone, welcome to EduTerrain and a warm good afternoon to you all. Hope you all are doing well and had a great day. So with the same enthusiasm, let's start today's session, that is Annual India TB Report 2024. Now this report has been launched very recently on 27th March 2024. 27th March को ये release हुआ था and it was released by the Ministry of Health and Family Welfare. And ये अभी सॉफ्ट कॉपी नहीं आया है, only the hard copy has been released. Okay, now why this is important, why this understanding the population of TB, that is the population of people who are infected with TB and others, why is this important? See, when we talk about TB as such, it is caused by a bacterium, that is Mycobacterium tuberculosis. TB itself is tuberculosis, so it is caused by this bacterium, and it infects those people who are generally undernourished or either their immunity is compromised. So when we talk about the number of cases, TB cases, it reflects the nutritional status of that population. So that way it will show, when the number of cases are more, obviously that would show India or our country in a bad light, that we are the population is undernourished or malnourished. So that's the reason keeping a tab on this, and it is one of those diseases that can be easily avoided provided proper care is taken, proper initiatives are taken. So hence this is one of those diseases which is very important to be counted upon, or to keep to look into that on a timely basis, and accordingly policies should be made. And as part of which, now currently India is targeting that India should be 0 TB cases. It should have 0 TB cases by 2025. That is TB Mukt Bharat. Okay, by 2025. This is what our target is, as part of which various initiatives are being taken up by the government of India with the help of the states and union territories. Thereby we want to bring whatever number that we have currently to 0 by 2025. Okay, with this introduction, let me start today's session. So before that, these are my credentials, you can go through it later as well. And as I have highlighted yesterday also, from tomorrow morning 9 a.m. on YouTube, we'll be having daily live sessions on MCQs, discussion of current affairs, regular current affairs on a daily basis. Okay, so let's start with today's session, Annual India TB Report 2024. It is published under the National TB Elimination Program, which is under the Central TB Division, which again is under the Ministry of Health and Family Welfare. So this report has been released by the ministry itself, that is Ministry of Health and Family Welfare. Now when we talk about these TB cases and all that, it seems that during the pandemic situation, maybe we were little bit slow on reducing the incidence of this disease in our population. But yes, post that we have improved and we have noted, or we have come out successfully in many of the parameters. We'll look into those parameters, what are they, how we have come out of that and all that. And that because of two major programs. So one, the National Strategic Plan 2017-2025. So here we have come up with various indicators. Okay, yearly indicators. We are going to do that in phases, and we have kept ourselves various targets, or given ourselves various targets, that in phases from 2017, uska threshold or baseline data that has been taken is from 2015. We are targeting that based on this data that we have retrieved from 2015. We are targeting that by 2025. The number of TB cases, the incidence of TB cases, that should be brought down to 0. Okay, and for which various parameters have been designed, that we'll look into that in detailed manner in a few minutes from now. And next is National TB Elimination Program, which is under the Central TB Division, where again The main focus is to end TB by 2025. Okay, this program actually it takes up various other initiatives under it, so that the target can be achieved. Now, when we talk about the annual India TB report 2024, the estimates related to the incidence of this TB and deaths, all these have been captured as part of this report. And very recently, in this year, for this report, a new methodology has been developed by India to capture this data and present this data, that is estimated number of TB cases, the number of cases reported actually, reportings from the private sector, that is private hospitals and private clinics, etc. All this data we have covered based on a methodology that has been accepted by World Health Organization as well. Now this is very, very important table for you as part of the annual India TB report, and this is the data of 2024. These two I have provided so that you can have an idea, okay, how it was and how we are faring well. As I have said earlier also, during pandemic, though our work or whatever initiatives that we have been taking to reduce this incidence of TB cases, that has gone down because the entire focus shifted to fighting with the pandemic. So but after that we have been improving. That is quite visible here. So here the estimated TB cases, the number of cases that are estimated currently, they are 27.8 from 27.4 lakhs. See, if we look at 2020, from that it has increased because of, again we couldn't work on that, but yes, अभी भी थोड़ा सा increase ही हुआ है, but very marginally, not much. The number of cases reported actually, how many cases have been reported? It is 25.5 lakhs, which is again little bit high. When estimated cases are high, obviously the reported cases would be high as well. And reportings from private sector, this has improved a lot. As you can see here, 7.3 lakhs say 8.4 lakhs. That is, the private sector is also actively engaged, okay, in working towards a TB free India. And here we can see that witness, and it is close to 33%. In few literature you can find it as 33% as well, but the exact figure, if you look at it, is the percentage of cases reported by private sector, it is 32.9%. And estimated mortality, it hasn't changed, though there is a marginal increase in the number of cases reported. The estimated mortality is less, which is again a plus sign. Okay. Yes, hello Avni. These are the most important data that you have to remember invariably. Okay. Now moving on to our, this in an elaborated way. The estimated incidence of TB in 2023 increased slightly. Now there are two terms that you have to understand here. TB prevalence, okay, TB incidence. Okay, TB prevalence is that, where the total, for every 1 lakh population they measure this. That is the total number of patients who are currently have shown the symptoms towards TB, for various kinds of TB, because TB is one such disease. When we talk about TB, the first thing that comes to our mind is the pulmonary TB, that is the one which infects the lungs, right? सबसे पहले वही आता दिमाग में. But TB can affect various other organs as well, like your spine, like your kidneys, brain, even bones also sometimes. Okay, so all those kinds of TB where the symptoms are related to all these, that is the TB prevalence. Okay, now what is TB incidence? TB incidence is that population where कई बार ऐसा होता है कि because of various reasons, because of lack of awareness, lack of proper monitoring or proper management, even though the person completely came out of the symptoms of TB, it can relapse. So TB incidence includes those cases as well, along with those population where the symptoms are conspicuously shown plus the relapsed cases. Okay, these two kindly understand, because when we have set target for ourselves that by 2025 we would be TB Mukt Bharat, we are monitoring both TB prevalence cases as well as TB incidence cases. Okay, so here the estimated incidence of TB has increased, as we have seen, marginally it has increased, which can be seen as a drop from 237 people per lakh. As I've said, both these will measure per lakh population. Okay, so it has reduced from 237 to 199 per lakh people. But did we meet our targets? As per the National Strategic Plan for removal of TB, or for removal of TB from India, we have seen that, as I've said, 2017 se 2025 tak we have set ourselves targets at different base phases, and one of those phases is 2023. Okay, now did we achieve the target? Currently it is 199, that is as per the latest report, but our target was only 77 cases per lakh population. So here there is still long gap that we can see here. So we have the government, they have to work a lot towards bringing this 199 to below 77, because by 2025 we are saying it should be 0. So you can understand this has to be brought down to 0 in another 2 years. Okay, or 1 year I should say. Now when we talk about mortality rate, it declined from 28 per lakh population to 23 per lakh. But again, did we meet our targets for the year 2023? No, because the target was only 6. But here we still stand at 23. So here again we have to work a lot. And the mortality due to infection, total mortality अगर देखा जाए तो it is 3.2 lakhs, which is same as the previous year. 2022 में भी उतना ही था, 2023 में भी उतना ही है. However, India's TB mortality dropped from 4.94 lakhs in 2021 to 3.31, which we consider it as 3.2 lakhs only, in 2022. Close to. It's not exactly. So this is same, that hasn't changed. And there were only 2.3 lakh missing cases of TB that were recorded in 2023 as compared to 3.2 lakh in 2022. How this has happened? By strict surveillance, okay, and also testing has been ramped up, because of which the missing cases, they were picked up. Okay, now India achieved its goal. एक goal India ने achieve किया है as part of that NSP, that is its goal of for 2023 by commencing treatment in 95% of the individuals diagnosed with the infection. So अगर 100 members को हुआ है तो almost more than 95 people already the treatment has started. So that way we are very much on the line or on the target wise. However, the number of cases and deaths recorded in 2023 fell short of targets set by the country, which we have already seen. 6 death होनी चाहिए, but it's not that 23 है. So likewise, we are still lagging behind in those cases. And in this report, they have also highlighted one more important point. What are those factors that influence or affect both the infection rate and the treatment outcomes? Okay, and those all fall under the risk factors. And as I said earlier also, this is one such disease that can be avoidable provided proper care is taken, proper policies are made, etc. And one of that is, as I've said, undernourishment. Because of undernourishment or compromise of the immunity, like because of diseases like HIV, diabetes, or usage of alcohol, smoking, etc., that all leads to a negative impact on the infection rate as well as the treatment outcomes. Now when we talk about undernourishment, whatever the total number of cases that have been diagnosed or the incidence of TB, of which nearly 7.44 lakh TB patients were undernourished. That is, this is one of the main reason for TB. To improve nutrition, the government is providing a monthly support of rupees 500, and already it has disbursed nearly 2,781 crores to nearly 1 crore beneficiaries, and this particular program is called as Nikshay program. Ni means nil, Kshay means TB. It's called Kshaya in Hindi or Sanskrit. Okay, so here this is a program wherein through which 500 rupees is being provided as a support by the government, so that the persons, along with the free treatment, completely free treatment, they can focus on the providing themselves with the nutritional food. Under the same program, they have also come up with the Nikshay Mitra program. Here, any person, any individual, corporate, organization, anyone, they can adopt minimum one TB patient and help them with all the support, that is financial support related to the treatment, food, etc. for minimum 6 months and maximum 3 years. So this way they are trying to support the TB patients, especially who are from a poorer background. Okay. We'll discuss about that in detail again, detailed manner in couple of minutes from now. HIV, another risk factor, that is human immunodeficiency syndrome, which compromises the immune system, okay, and leads to acquired immunodeficiency syndrome, that is nothing but AIDS. Okay, people living with HIV, it seems that they have 20 times higher risk of developing symptoms of TB as compared to any normal person. Altogether, 94,000 TB patients in 2022 have been found to have HIV. The program provides preventive therapy to the HIV positive, ensures early diagnosis of HIV and TB through either programs. That is, AIDS ke liye, HIV ke liye already we have programs. So, in that also they are focusing on this particular part, whether the patients, the HIV patients are, they have TB or not. At the same time, awareness programs are being created so that preventive therapy can be provided to these HIV patients so that TB incidents can be avoided. Okay, now the third important risk factor that has been noticed is diabetes. Of the 3.7 lakh TB patients with diabetes globally, it seems that 1.02 lakh were in India itself. Now, since we are highlighting here the global data, just let me give you the global TB data here itself. See, very recently in December itself, December 2023, World Health Organization, it has released the global TB report, okay, for 2023. As part of which they have highlighted that whatever the total population of TB patients that are there in the world, 27% of them are from India only, and this percentage is highest in the world. So it seems we as a country, we have 27% of the TB patients in the world. Okay, important this one. And this is first highest, and second comes Indonesia, where they have 10% of the total TB patients in the world, and Philippines third with 7%. And it seems top 30 such countries, they account for, top 30 such countries account for 87% of the total TB cases in the world. Okay, this is some of the data. Since I got a chance here, I wanted to highlight this. Okay, now coming back to our risk factor, diabetes. Diabetes escalates the likelihood of contracting TB 2 to 3-fold, which in turn is linked to increased risk of multi-drug resistant TB. Now, when we talk about TB, there are regular TB, and there are two other types of TB. One, that is drug resistant TB, because of various reasons. Like what happens is, if any person has been diagnosed with TB, there would be a certain medication, at least 5 to 6 months they have to complete that medication, whatever medication that the doctor has suggested. Okay, if in case the medication has been wrongly prescribed, diagnosis ही गलत ही हुआ है. Okay, yes Sarpan, even I was shocked when I saw this report that African countries 5th position पे है. Nigeria, it's in 5th and 6th position, बहुत नीचे है. Even Pakistan and other countries, Bangladesh, which we tend to perceive them as the poorer countries, they don't have this much incidence of TB there. Okay, so okay, coming back to our this one. See, when we talk about TB, there are two kinds of TB. One is that is regular TB के साथ साथ the drug resistant TB. See, when a person when he is diagnosed with the disease, the doctor will prescribe the medication. At least for 5 to 6 months, the person has to undergo the medication. Okay, but sometimes what happens, गलत डायग्नोज हुआ है, पल्मनरी टीबी है लेकिन कुछ और डायग्नोज हुआ है, अकॉर्डिंगली मेडिकेशन हैज़ बीन प्रोवाइडेड, और द पर्सन हिमसेल्फ, अरे 2 months में ही ठीक हो गया है, वाई शुड आई कंटिन्यू विद द मेडिकेशन, he'll stop. Okay, or after a certain period of time he stopped taking care of himself when it comes to the nutrition, etc. So all this, what happens, that leads to drug resistant TB. Whatever drugs that are being prescribed for this for treating the TB, they'll not work on that person. Okay, so this is drug resistant TB. Now there is one more, multi-drug resistant TB, MDR TB. Now here there are two major first line effective antibiotics that are prescribed for TB. Those two medications also will not work on this person who is suffering from the multi-drug resistant, and one of the reasons being the same thing, leaving the treatment in between, or not following the medication properly, or not taking care of himself while undergoing treatment for TB. All these, they lead to these two variations of TB. Okay, so here, why diabetes, if a person has, that can also lead to increased risk of multi-drug resistant TB. Okay, so the TB treatment also does not work as well in diabetics. Nearly 92% of the TB patients were screened for diabetes in 2023, with 7.7% being diagnosed with it. Close to 7.7% अभी भी है. Nearly 63% of those diagnosed initiating diabetes treatment as per the report. Already they are undergoing diabetes treatment as well. Okay. Now the fourth important risk factor, that is alcohol. It seems that a daily intake of more than 50 ml of alcohol increases the risk of TB infection, active infection and recurrence of infection. See, कई बार ऐसा होता है कि बाहर कई सारे bacteria would be there, but if you are healthy, even though the mycobacterium tuberculosis, even if it comes to you, it will not be able to attack, though it can be found on you. Okay, so the TB infection, that is where you're not completely infected, where the prevalence is there but not infected. Active infection incidents, they are infected, and sometimes relapse, that is recurrence again. So all these will increase in case alcohol is taken, and around 18.8 lakh or 74% of the TB patients underwent alcohol use screening, of which 7.1% were identified as alcohol users. Diabetes में 7.7%, यहाँ पे 7.1%. Okay, tobacco usage, in this 11% have been identified as the tobacco users for the year 2023, and 32% of these identified people, they're also working on leaving that is cessation services. As per the report, they have left usage of tobacco. ये इतने in detail important है. This would be important, these two figures, this figure. Okay, now अभी तक हमारा annual India TB report, now it is done. Whatever the important figures that have been already revealed, क्योंकि इसका अभी ऑनलाइन रिपोर्ट आया नहीं है, So whatever that has been released as part of the press release, that only I could get here. Okay, once they upload the the soft copy on the site, then I'll go through it again. If there is anything that is required, then I'll let you know, but I think that will take time, because last year ka jo report tha, last year 20th March release हुआ था report, that has been updated very recently on the site, so this might take some time, so we can wait. Yes, now as I've said, there is one program or one initiative that has been taken up by the government, that is a National Strategic Plan TB Elimination in phases from 2017 to 2025. Now what exactly is this? Now this is a strategic framework, the name itself suggests, to drive the acceleration of the progress towards TB elimination and achieve the SDG and end TB targets for India. As per these targets, by 2030, there should be zero incidence of TB cases in the world. Okay, at least in India. But we have targeted ourselves that by 2025 itself we will be achieving this. Okay, it expects to guide the activities of all stakeholders whose work is relevant to TB elimination in India, including the central government, the state governments, the union territory governments, the private entities, the sector who are involved into this TB elimination. Now its vision is TB free India with zero deaths, zero disease and poverty due to tuberculosis. Goal is to achieve rapid decline in the burden of TB, morbidity and mortality while working towards elimination of TB in India by 2035. This is the main goal of this particular program, and it has four major pillars, or it works on four strategies. So 1, detect, find all those people with TB cases with an emphasis on reaching everyone, including in the private sector, which we have done fairly well when compared to the previous years, where from private sector also we are able to screen out the TB patients. Now once we detect, what should be done? Treating. Treat all the people with TB with high quality anti-TB drugs. Okay. Now a question for you, is there any vaccination to avoid TB? If yes, what is that? This we'll discuss in tomorrow's class. Okay, now what? Treating, prevent. Now ek to treat ho gaya. The third important strategy that we are following is prevent. Now we have to prevent completely altogether this disease. So prevent the emergence of TB in vulnerable populations and stop catastrophic expenditure due to TB, because it is one of the costliest diseases. We have to, on a multi-faceted treatment should be given along with the medication, especially the costliest of the antibiotics. They have to be provided with nutritious food and proper care, etc. Now last, build and strengthen the supportive systems, including enabling policies, empowered institutions and human resources with enhanced capacity, so that we can all together make India TB free by 2025. Okay. Now as I've said, under NSP there are various targets that we have set for ourselves, that all fall under this results framework of the NSP. Outlines the various targets, that is impact and outcomes that needs to be achieved. Baseline data 2015 ka le rahe hain, and 3 phases it is being done. 2020 ka 1, 2023 2, and by 2025 this is the third phase. Okay, to reduce the TB incidence to 44 by 2025. To reduce the TB prevalence to 65 by 2025. To reduce estimated mortality due to TB, that is 3 persons only, by 2025. To achieve zero catastrophic cost for affected families due to TB, that is zero incidence of TB. Matlab, bilkul. That is, they should not be affected at any cost, this particular disease. So these are the targets, 4 targets that they have set for themselves, that is impact indicators, and this is what we stand at. Just now we have discussed, no, 77 TB incidence cases, but we still have 199 for 2023. And deaths 6. This is all per lakh. This is all comes to per lakh, but there we are still at 23 or 28. And zero catastrophic cost for affected families, still we haven't achieved this 0%. So let's see how we are going to do. By 2025 we'll be able to get that. Now under this NSP only, there's another program that has been launched, that is National Tuberculosis Elimination Program. Okay, now this particular program has been launched in 1997 itself. Later on it has taken various shapes. Okay, under which very recently, that is in 2016 or 17 itself, they have launched this Nikshay. It is a web-enabled patient management system, and this is majorly for the TB control under this NTEP program. Okay. Now it is developed and maintained by the Central TB Division, Ministry of Health and Family Welfare, Government of India, in collaboration with National Informatics Center, which is under the Ministry of Information, Electronics and Information Technology, and WHO, World Health Organization's India office. Okay, all these, they have come together and helped in developing Nikshay portal. It's an end-to-end patient management system, that is various stakeholders, including the healthcare professionals at different levels in the nation, they'll be able to utilize this system for the registration of the TB cases under their supervision, and also to understand what kind of tests are being done, where they are being done, documenting the treatment specifics, because this is one disease, as I've said, if proper care is not taken, it can lead to drug-resistant TB or multi-drug-resistant TB as well. So for which very carefully they chalk out the entire treatment plan and they monitor it thoroughly. So for that, they should have some portal or some place where they can enter all the data, and from there, whatever the program that is being organized, that is the National Tuberculosis Elimination Program, they should be able to look into that data and understand, based on which only policies would be made. That all is done under this Nikshay portal. It also functions as a national TB surveillance system. That is, it provides with real-time data related to the patients, their treatment, etc. Okay, important. Now comes the National Tuberculosis Elimination Program. As I've said earlier also, it was launched in 1997, after which it was renamed as Revised National Tuberculosis Control Program, and currently the final name that they have given is National Tuberculosis Elimination Program, which is a public health initiative of the Government of India to organize its anti-tuberculosis efforts. Various efforts that are being done under this particular program, and it is a flagship component of National Health Mission. Majorly, this provides technical and managerial leadership to anti-tuberculosis activities, whatever that are being taken up in the country. Now, if we look at these two, this plan, National Strategic Plan, is the one we have planned everything under which all these initiatives are being taken up. Okay. Now, what are the features of National Tuberculosis Elimination Program? The first thing, the patients are supported with free diagnostics and medicines, that is free tests and medicines. Regular supply of anti-TB drugs to all the state or union territories under this program is being done throughout the year. Regular assessments are conducted to evaluate stock position at various levels, from central warehouses to peripheral health institutes, related to the anti-TB drugs that are being provided. Okay. In 2018, under the scheme Nikshay Poshan Yojana, the Government of India is providing free nutritional support of ₹500 per month to all TB patients registered in Nikshay till completion of the treatment. That's the reason whoever is treating these TB patients, it is very imperative for them to incorporate all these data, details, etc. on Nikshay portal so that they can avail this amount. The patients can avail this amount. Now, very recently in 2022, in order to make people participate and also to create an awareness about this disease among the masses, a campaign was launched on 9th September 2022, a nationwide campaign called as Pradhan Mantri TB Mukt Bharat Abhiyan campaign. It was introduced by the Ministry of Health and Family Welfare, again through their Central TB Division in 2022, wherein they they have taken this as Jan Andolan initiative. So as a part of this initiative, what they have planned is they have requested the communities or individuals to come forward, individuals, NGOs, cooperative societies, faith-based organizations, corporates, political parties, anyone can come forward and adopt a minimum one consented TB patient and support them in the form of nutritional support, nutrition supplements, additional investigations and vocational support for a minimum period of 6 months and maximum period of 3 months. And that particular person or the individual or the NGO or corporate, whoever is taking up this particular work, he or that entire unit is called as Nikshay Mitra. Anyone, if you want, you can also come forward to take this up. Okay, so this way we are trying to create a pool rather than the entire burden on the government itself. They are trying to invite communities to come forward and take responsibility of these TB patients, especially those who are from a poorer background. Okay, now other than this, few latest current affairs. Now, as per the Global TB Report 2023 that has been published by WHO, just now we have seen the estimated number of drug-resistant TB cases in India has reduced by 21% from 1.4 lakhs in 2015 to 1.1 lakhs in 2022. Still, we have very high number of drug-resistant TB cases in India. But still, we were able to reduce that. How we have done that? By involving various latest tests like nucleic acid amplification test, line probe assays, liquid culture testing labs. All these have been launched or started majorly for diagnosis of drug resistant or multi-drug resistant TB. Universal drug susceptibility testing is implemented to ensure every diagnosed TB patient is tested for this particular test to rule out the drug resistant at the time of diagnosis. Newer drugs like bedaquiline and delamanid introduced for management of drug resistant TB. मैंने earlier two names लिए थे. अच्छा, did I? No. See, general जो TB होता है उसके लिए 2 medicines are prescribed currently which are found to be very good. Okay, that include isoniazid and rifampicin. Okay, these two. But some, as I've said earlier, also drug resistant cases में these two also will not work. In that case, these are the newer drugs that can be utilized, but again little bit costly. So this have been introduced as a part of the treatment to these people, that is drug resistant TB patients. Decentralized drug resistant TB treatment services are being offered through 792 that is drug resistant TB centers across the country. This is data as on December 2023. Okay, latest data ये है. Year end data जब आता है ना उसी time पे they have come up with this. Rest of the important data related to Global TB Report 2023 have already discussed with you, right? Yes. So this is all from my end related to this particular report. वेरी इंपॉर्टेंट फॉर यू, एटलीस्ट वन क्वेश्चन वुड कम फ्रॉम दिस, क्योंकि लेटेस्ट रिपोर्ट है एंड इम्पॉर्टेंट भी है रिलेटेड टू ESA. व्हेन वी टॉक अबाउट ESA, उसमें हेल्थ सोशल जो स्ट्रक्चर सेक्टर है, अंडर दैट दिस वुड बी इम्पॉर्टेंट. ओके. एंड वन मोर इम्पॉर्टेंट पॉइंट आई फॉरगॉट टू ऐड, WHO का जो रिपोर्ट आया था, ग्लोबल TB रिपोर्ट, एज पर दैट रिपोर्ट every year 10 million people they are affected with TB. Okay. And at least 1.5 million people die because of TB as per this report. Okay. Yes, this I forgot to add. Now coming to our homework questions, answers to the homework questions. Yesterday I had asked you which is the operating agency for the fund of funds for startup scheme. It is SEBI, Small Industries Development Bank of India, whose headquarters is in Lucknow. Under the same fund of funds for startups, support is extended to alternative investment funds registered with which regulatory body which in turn invest in startups. It is SEBI, Securities and Exchange Board of India. उसमें जो registered AIF से उसको हम लोग under this FFS support is, that is financial support is provided. And these two are today's questions. As per the framework of NSP TB elimination 2017-25, what is the target to reduce estimated TB incidence rate per lakh by 2025? And in 2018, under the scheme Nikshay Poshan Yojana, the government started providing free nutritional support of how much rupees per month to all the TB patients who are registered in Nikshay till completion of the treatment. Okay, we'll discuss these answers in tomorrow's class, or you can comment and tell me the answers. I'll be checking the comments. Okay. So yes, thank you very much for being with me so patiently. Yes, now the forum is open for your queries, questions, comments on today's session, suggestions. All are welcome. थोड़ा सा लेंदी हुआ है, but yes, everything that is important we have covered. We haven't missed out on any important point. Okay, since I'm not getting any queries, I'm winding up the session. See you all tomorrow then. Okay, if you have any queries, you know where to reach out to me. Telegram group है, app पे भी मैं available रहती हूँ. There also you can send in your queries. Okay, so see you all tomorrow morning 9 AM. हम लोग रेगुलर करंट अफेयर्स के क्वेश्चंस डिस्कस करेंगे फ्रॉम टुमारो. ओके, thank you very much once again. Have a great day ahead. Please take good care of yourself. Bye bye.